Health services in Nigeria have moved from mere consulting clinic status, which defined the basis of the 1983 military coup. It is agreed that the Nigerian health system is relatively weak and there is yet a coordinated response across the country. A number of health workforce crises have been reported in recent times due to several months' salary owed, poor welfare, lack of appropriate health facilities, and emerging factions among health workers.
When the people protest, you threaten to sack them, you go ahead to issue notice of employment. In the middle of COVID, is this an appropriate response? It is not an appropriate response.
Nigeria is ranked 187 in World Health Systems among 191 member states, ahead of Democratic Republic of Congo, Central African Republic and Myanmar in the results collated by the World Health Organization. The outbreak of coronavirus has exposed the health sector in Nigeria for its weakness. And yet, in the revised 2020 budget presented by President Muhammadu Buhari, capital allocations to the social sector were largely caught, which includes Ministry of Health by 25%, Ministry of Education by 20%, and Women Affairs by 38%. The big question is why cut capital projects in health sector in a global pandemic.
You can imagine if our budget is not up to the budget of so many hospitals in the US. So what are we doing? We need to increase the capacity. We need to build on the capacity of the health workers. I'm talking about the doctors, the nurses, the information health management system, and all the other people that work in the hospital. We also need to build more hospitals. We have about 309 PHCs in Lagos, but are they well equipped?
Nigeria really hasn't done well. We always lay claim to the Abuja Declaration, which was signed in 2001, where the head of state agreed for at least 15% of their annual budget budgeted to health. Nigeria really hasn't done that. We've not even got up close to 10. So financially, of healthcare financing, really we've done poorly.
With the daily worries of poor primary healthcare services and facilities, we could categorically say we still have a long way to go. In April 2019, Minister of Labour and Employment Dr. Chris Ngige announced that doctors who felt they could relocate in search of greener pastures are free to do so. That sounded unpleasant to many who felt the demands of the job required a decision between life and death. Note, these are the same doctors the nation seeks at this period where we battle increasing number of COVID-19 cases.
Perhaps because Nigerians no longer hold government responsible, that they can afford to toy around with the lives of Nigerians. Because I consider slashing somebody's salary in an effort to provoke the person to react as insensitive. And this will only happen in a society that is not accountable.
No doubt, health workers directly benefit from government's interventions, but the public benefits even more when health service delivery is optimal. Onyechi Ogu, Galaxy TV News, Lagos.